Mask wearing by COVID-19 positive individuals as source control for SARS-CoV-2 spread, evaluating efficiency, limitations, and best practices. The objective of this paper is to explore the question, in COVID-positive individuals, how does wearing a mask affect the spread of COVID-19? Based on the research, surgical masks and N95 respirators have demonstrated to be an effective strategy for reducing the spread of COVID-19 by individuals who've tested positive for COVID-19. The two key points are supported by the research and indicate that communities that wear masks reduce the spread of COVID-19 infections, and when individuals that are COVID-19 positive wear a face mask, the amount of viral load they exhale into the environment is significantly decreased when they wear a well-fitted N95 or surgical mask. The key factors that influence effectiveness include the filtration efficiency and the fit of the mask on the face. There are limitations by the studies, such as observation bias and the inability to replicate the complexities of real life. Based on these key concepts and also acknowledging study limitations, the evidence strongly supports the use of masks, particularly in healthcare settings, to mitigate the spread of SARS-CoV-2. Linking findings to practice, my recommendation is to advocate and prioritize the consistent use of a properly fitted N95 respirator by healthcare workers when providing direct patient care, especially in the setting with vulnerable population like long-term care or during periods of high community transmission of respiratory infections. While all masks offer some benefit, N95s offer superior source control and personal protection. It's important to be vigilant and adapt policies based on local infection rates, and as evidence changes, it's important as part of evidence-based nursing practice to consider those factors as well. Nurses are in constant contact with patients. It's essential to understand the protective capabilities and limitations meant to prevent the spread of infectious illness. So to summarize, key findings include that there is a community-level impact, varied droplet emission reduction depending on fit and type of filtration used, and additional impacts from wearing masks like headaches, dermatitis, and impaired communication. Additional concerns, measures of carbon dioxide inside of the masks. Europe and China do consider this, but it is not considered in the certification in the U.S. These factors impact compliance and thus effectiveness as well.